Hello and welcome to the Catalysis Continuous Improvement Podcast. I'm Mark Graven, and today we are doing a preview of a webinar that's going to be presented on August 19th at 1 o'clock Eastern. It's titled Becoming the Change, Leadership Behavior Strategies for Continuous Improvement in Healthcare. And these are actually, I think, going to be great strategies for people in any industry. And we're fortunate to be joined today by our two presenters, Dr. John Toussaint and Kim Barnas. How are you?
Great, Mark. Thanks for inviting us.
Yep, thanks, Mark.
And thank you in advance for doing the webinar. And I should also mention, if people want to register, they can do so at www.kinexus.com/webinars. And if you are listening to this after August 19th, you'll be able to find the recording on our YouTube channel and our podcast feed. So before we preview the webinar a little bit, Kim, can you introduce yourself to the listeners and tell them a little bit about your background and what you do now?
Thanks, Mark. I work as the CEO of Catalysis, and in this role, I have the lovely opportunity of having many faculty and staff members that serve to help educate, coach, and teach many of our healthcare leaders in the country and actually in the world. Most of my time is being spent doing executive coaching over the last 3 years in South Africa, the UK, and in North America. And using lean philosophy and the Shingo model, we've really come to an understanding of what is important in terms of the transformation of an organization and the way a leader behaves. And so we've been doing a lot of research and a lot of work in that arena.
And I think a lot of listeners hopefully are familiar with Kim's previous book, Beyond Heroes. So I really do recommend that. And, Kim, before Catalysis, is an accomplished healthcare executive. So she brings that perspective to the books and to the webinar. So thank you again for that, Kim. And John, can you introduce yourself for the audience as well?
Sure. Well, I'm an internist and former CEO of an integrated health system in Wisconsin, and really have been a student of this lean thinking, organizational excellence thinking now for almost 20 years. And like Kim, I've had the privilege of working with many healthcare leaders around the world. And we've found that there are some really core behavioral traits that, when practiced, really make a difference in organizational performance. In other words, as the leaders model the way, the whole organization follows them. And if we are modeling the right behaviors from a continuous improvement culture standpoint, we can unleash the creativity of everybody on the team in ways that were unimaginable. So we're excited to share what we've learned from these other leaders, not necessarily, what we did, but way beyond what we did. And it really is about, organizations change when leaders change. And so this whole, the webinar, but also the book Becoming the Change, is about what are those changes that we can make as leaders that really are going to drive performance in our organizations.
Yeah. So we'll come back and touch on those behaviors and what you'll be sharing in the webinar in a second. But also wanted to mention, again, listeners may be familiar with John's books, On the Mend, Potent Medicine, and Management on the Mend. And as John alluded to, John and Kim have a new book coming out that shares the title of the webinar, Becoming the Change, Leadership Behavior Strategies for Continuous Improvement in Healthcare. That book's going to be out pretty soon, right? What's the expected date?
It's going to be out August 24th on Amazon.
Okay, great. Real soon. So I encourage people to go check that out. And so, John, you mentioned behaviors. The two of you are going to be sharing, I think, some really practical methods that leaders can use to self-assess behaviors. Can you share just a little preview of what people will learn in more detail in the webinar?
Yeah, well, we will actually present a tool that we've been using with senior leaders and CEOs for quite a few years, which is a way for them to actually create a self-reflection mechanism And, we're a big believer that, your worst and best critic is yourself. So if you actually spend the time reflecting on how you're actually doing as a leader, it helps you understand where you want to focus. So Kim will really spend time on how you use that tool. And then I'm going to spend time on something called a personal A3. We're all used to problem solving and strategy A3s, but not a lot of us are used to using the A3 thinking for personal development. And we learned a lot about this from Margie Hagany, one of our great faculty members at Catalysis. And we've been using it for quite a few years now. And I'm going to actually walk through how you use an A3 to develop yourself as a leader, and the template that we use to do that.
And Kim, is there anything else that you would add about the idea of self-assessment or personal improvement plan A3s?
Well, I think we've been using these A3s internally and with our leaders for several years. And what we have found is that it's a great tool to look at your opportunities for improvement, not to correct problems, but to change behavior. And that it's a self-reflection. It's a tool that's personal and that it changes and adjusts over time. And so it's a great way to mark your progress, but it's also a great way to think about where can I really focus my attention on observable behaviors that others can help me reflect on and that I can choose to engage to become a stronger leader.
Well, I think those are important ideas and important leadership behaviors and strategies, again, for leaders in any industry. So I know we'll have an audience and people from different industries. I encourage people, even if you're not working in healthcare, there's a lot you can learn from Kim and John. So again, to register for this, please go to kinexus.com/webinars. This is going to be presented live August 19th, 1 o'clock Eastern. So, of course, if you tune in live, you'll be able to ask questions of Kim and John. Otherwise, we'll encourage you to check out the recording and go on Amazon and look for the book. Again, same title as the webinar, Becoming the Change, Leadership Behavior Strategies for Continuous Improvement in Healthcare. So, Kim and John, thanks so much for doing the preview here.
You bet. Thank you.